Friday. You know what day it is? It's Pharmacy Friday. I'm ready for a weekend. This is This Week in Pharmacy. My name is Todd Uri. I am the RX Podfather, or the Podfather of Pharmacy. I'm excited. I tell you what, I'm always excited, but I really am this week because we're headed to Dallas for the 2023 National Association of Specialty Pharmacy annual meeting. If you are into specialty pharmacy, if you are headed to that meeting, make sure that you connect with the Pharmacy Podcast Network. We will be in the booth with the NASP running their podcast, just like we did when we were at the APHA, the American Pharmacists Association. It's exciting to see pharmacy expanding into different new markets. I think of pediatrics, for example. Before I get started in some of our news, I want to give a shout out to Dr. Justin Cole. Justin Cole, he is over at the Cedarville University School of Pharmacy. Here's his contact information. If you see the screen, if you're watching on live, if you're watching on LinkedIn or you're watching on YouTube, reach out to Josh or Justin just for for LinkedIn or to hook up with him and ask him questions about pediatrics and the pediatrician, the future of pediatrics and the pediatrician focused pharmacist. I want to give a shout out to Jenna Quinn as well. Dr. Jenna Quinn is our host, one of the co-hosts, because she'll be teaming up with Justin. But she and Justin are going to be tackling major issue and issues that are coming out in protecting our children, and how the voice of the pharmacist is the advocate of our children. And those two are amazing. Thank you so much. Their podcast is called the Pediatric Pharmacist Review. Once again, that's the Pediatric Pharmacist Review. Look up that podcast, all things about pediatrics. We're going to be releasing a blog, a very intense blog, as to the opportunity that is before us for pharmacists in pediatrics. And I'm excited to open up more opportunities for pharmacists that want to get into either health systems or helping with primary care in pediatrician consultancy. If you're interested in that, would you reach out to the Pharmacy Podcast? Would you send me an email? My email address is publisher@pharmacypodcast.com. Once again, that's publisher@pharmacypodcast.com, because I want to build a special series collaboration with Jenna and with Justin on that show. So NASP, specialty pharmacy, we're going to that. I just interviewed the founders who are running the Doctor Patient Forum. I'm not sure if you've ever heard of this forum, but if you haven't, please look it up. The Doctor Patient Forum. This is a group that is dedicated to advancing the voice of people that are going through pain, people that are experiencing pain. I interview Claudia and Bev, who's both on the show with me. We'll be releasing this probably either late next week or the week after that. I'm not actually sure, because our queue is full right now, which is wonderful, that we have so much content coming out driven by our pharmacist. But this interview is very special. Bev and Claudia really kind of tell me the frustrations that they experienced as pain patients and how they were made to be shunned and not be allowed to voice their opinions on many aspects of pain management and their own pain management. But now they're standing for about 300,000 followers who are connecting into them about all types of issues that they experience as pain patients. So be on the lookout for that podcast. In the meantime, if you want to look them up, the name of their organization is the Doctor patientforum.com. That's the drpatientforum.com. So I want to hear from pharmacists out there in specialty pharmacy. As I mentioned, we're going to the National Association of Specialty Pharmacies annual meeting, but we would like to understand more for our listeners in the field of oncology, blood disorders, as well as if you are a specialty pharmacist and you know a pharmacist that is in specialty and you're in specialty. I'm trying to gather up people who are comfortable with each other, that can talk between each other about anything and everything in rare disease. But really, we're looking for specific or information on blood diseases, because we have a really interesting sponsor coming to us asking us for experts that are pharmacists in blood disease and also medication management of polypharmacy for patients who are also cancer patients, blood cancer. So please reach out to us and let us know if you're interested in participating in that. Haven't been able to really tell you what's happening for the Pharmacy Podcast Network, but we are now international. We have listeners all over the world, but more importantly, we have 2 pharmacists that are joining the Pharmacy Podcast Network. Dr. Katrina Azur is really New Zealand's leading. This is pretty exciting. Leading pharmacist in digital health. Katrina Azur. If you don't know anything about her, look her up. Katrina, Katrina Azur, Azer. For those people who aren't watching, Katrina is a passionate precision medicine telepharmacist, and she has a podcast on her network called PharmXL, a podcast. And she is a breath of fresh air, really recognized as a leader in digital health, thought of as the leading pharmacist in digital health within New Zealand. And I'm just proud to have her as part of our network. That's the best thing for me is linking pharmacists together. Think of how many pharmacists who have been on the Pharmacy Podcast Network are now working with other pharmacists, and that is literally the purpose of the Pharmacy Podcast Network, is to drive change and better pharmacy care, but doing it because of the collaborations that we build through this network. And there's no other network like this. We have posted something, if you heard, on LinkedIn, just for some, I guess we can call it the rumor mill. I posted a post on my LinkedIn that was talking about 2 different organizations who are taking, or at least trying to take, advantage of what I built for the last 14 years, in all dedication to the success of pharmacists and improving pharmacy care. And it comes down to having to hire lawyers and having to have trademarks to protect your information. And I've never intended that to be like this. I'm just going to be frank with you. And this is a different kind of TWIRx this time. It's This Week in Pharmacy. We have 2 special guests that are upcoming. We have Dr. Cory Jenks, who is a wonderful author, Permission to Care author. And then we have the founders of Shift.Health, which are 2 mavens in changing how pharmacists are going to be able to manage their careers. They're starting in the state of Texas. So this is a very special episode that is upcoming. But I want to just tell you about the Pharmacy Podcast Network from another perspective, something that you've probably never heard of if you're listening right now on the podcast. And that is, we're a small organization. We're a small publication. We have support from Finn Partners, who is kind of like our big brother, big sister organization. They provide a lot of administrative support for the Pharmacy Podcast Network. And then, of course, us as a small publisher, we rely on sponsorships to keep us going. We have some wonderful sponsors. Shout out to the organizations who have used our ability to reach up to and beyond 100,000 listeners per month. We've worked our butts off. Now we come up with ideas over the years and programs over the years that have advanced community pharmacy, specialty pharmacy, opioid use disorder, and the attention around what we've done in stigma with the Pitt School of Pharmacy, University of Pittsburgh School of Pharmacy, and Duquesne University School of Pharmacy. and the Pennsylvania Pharmacists Association. It was called Let's Talk Stigma. We've worked with the FDA, pharmaceutical manufacturers, the APHA. I'm very proud of what we've built. I'm so proud of our pharmacists who are using this platform to push their podcast out. So when organizations try to take advantage of what we've built and then turn around and copyright or trademark it, it's very, very frustrating. RX Podcast is a podcast initiative that I built in 2018. And it was all about how do we use podcasting to teach our pharmacy owners how to use that medium, how to use that communication tool, just like you would with social media. How are you going to customize podcasting for your community? Think about this. Think about Butler, Pennsylvania. My whole side of my mother and, well, actually both sides of our family, it came from Butler, Pennsylvania. And if there was a community pharmacist in Butler that could speak on a monthly podcast to their community about specific things happening in the community, they could get the school district involved. They could involve the mayor. They could involve state representatives. They could talk about initiatives and public health, really building a platform that could become the healthcare show for a specific community. So rxpodcast.com, once again, rxpodcast.com, was always put together with the support in mind of a community pharmacy, really being able to take advantage of what we know, giving you all of our secret sauce. And unfortunately, there's another organization out there that is trying to trademark RX Podcast so that they can take advantage of it for themselves. And they're not lifer podcasters, and they're not tied into the rest of the pharmacy industry the way that our network is and the way that our pharmacists are throughout many organizations. So that's number one organization. I can't stop there. So there's a number two organization out there who is now using the term Pharmacy Podcast Network. Come on. Let me ask you something. Are you a community pharmacy owner right now? Do you own a independent community pharmacy? Just, it's a yes or no question. So some of you listening, you're like, yes. Some of you said no. The ones that said yes, are you a member of the NCPA, the National Community Pharmacists Association? Maybe you are, maybe you aren't. They're a wonderful organization. So if it were up to me and I was a community pharmacy owner, I would join the NCPA. Why? Because it's the advocacy for all things community pharmacy, right? What is the Pharmacy Podcast Network? That is any organization, any pharmacist, any pharmacy technician, any pharmaceutical manufacturer that wants to come together in the world of audio discussion and podcasting, and working together to change our profession. That is what we are. You do not need another podcast network. I've never said no to anyone that wanted to come on this network, ever. I've had people come and go. We've had people come to the network, publish for a while. They get too busy. I know what life's like. Life's crazy. So if you want to come to the network and work with us on a permanent project, or you want to come to the network and work with us on a temporary project, if you're a big organization that has multi-millions of dollars, which is exactly what this organization is, not going to say any names yet, but if you are and you want to come to this network, you are welcome here. This is access to all of these pharmacist listeners that are here, that are ready for you to help us, help you, help them make pharmacy care better. And that's kind of some of the, I surprised Brady, who's our producer, and not jumping to actually news, but that is the news. The news of the day is what's current event in pharmacy podcast land. I never really talk about our organization and what we go through day to day. A shout out to Brady Yuri, our producer. A shout out to Rachel Medlock, who handles all things project management and program manager for our clients. And a shout out to Tyler Claire Mayers, also my daughter, who is in our graphics and video support. She puts together all of the TWIRx stuff and does everything for our clients from a graphics perspective. The purpose of what we do is to advance the voice of the pharmacist and to improve our profession. And I will work with anybody, even if I disagree with your politics, even if your politics might be slightly different than mine. I'm a libertarian. I lean probably more to the conservative side of things, but I believe in what's right for our patients. Rachel and I just talked about how do we build content that is really advancing the voice of our patients, which really, to me, that's the most important voice. So I'm telling you, we have so much happening in pharmacy right now from a perspective of our laws being changed, PBM reform. We have people that are advocating for pain management patients. We have senior care initiatives happening. Has the rest of the podcast nation and listeners, have you understood what's happening in senior care? I wanna give a shout out to SoftWriters. So SoftWriters is a company that's actually where I started in pharmacy. When I started in pharmacy, I worked for SoftWriters as their first business development uh, uh, sales representative for their platform called Framework LTC, which is a pharmacy management system all about long-term care. And what's happening in long-term care as well as community, there's going to be a fusion where there's going to be kind of like this middle ground. And that is home care is more important than ever because there's an expansion and there's a need for more home care services. And we're talking about light bathing, shopping, cleaning, more services for people, mostly probably seniors, with the baby boomers coming and expanding in population throughout the country. But our population is in need of more home care services, and they're in need of not putting people into facilities because sometimes there are no more facilities available. And of course, we're talking about the expense, especially things like skilled nursing. So, guess what? Pharmacists are going to play a crucial role in the expansion of home care and how home care is going to be fused with pharmacist oversight in consultation, remote patient monitoring services, telepharmacy, okay, and then being able to answer back and kick back and connect back to our physicians and how physicians can't do everything, right? They're overrun. So our community pharmacists are going to meet some of their patients there, and our long-term care pharmacies are also going to meet patients there. So I want everyone to start thinking about how do we make that symbiotic? How do we work together? How does the ASCP, American Society of Consultant Pharmacists, and the NCPA, how we educate the membership about the needs of their communities? And I want to do it just through our podcast as well. We're going to be talking about more long-term care services um, for our seniors and how community pharmacy through technology is going to be able to take advantage of some of the systems that many of our long-term care pharmacies have relied on for years in order uh, to coordinate shipping to and delivery to each of their clients, each of their customers within the community, and then also the world of keeping track of medications. Think about how many people, shut-ins or people who can't afford to go to an expensive facility. Think about that. Think about the stress on them in order to do their own medication management, or their sometimes a caregiver or a child or someone's trying to figure out their parents' medications. There is um, there's a cloud of unknown in many ways, and I worry about, even my own two parents. Neither of them are on an intense amount of meds, so that's wonderful. But when they have questions, I who are they gonna call? Who's gonna follow up? Who's gonna make sure that they're safe? And this is a huge opportunity for the pharmacy profession to step up with the coming needs of our baby boomers. I want all of our listeners to think about this and how you're helping as a provider to make this better for your own community. And reach out to some of your independent community pharmacies and find out what they're doing. Find out if they need help, maybe for taking partial shifts to provide services. Maybe it's a short term consultancy for someone in need of a pharmacist to really understand what's going on in their home and in their medication needs. And then what they are also the component of really understanding what's happening. You know what your patients go through. If you're in a chain pharmacy right now, if you're in community long-term care, especially, you pharmacist, you know what your patient's going through. So I want to also mention the component um, of the laws that are being created and the policies that are being created to govern our PBMs and to change payment for coverage of medications, and how expensive things have become for people that have limited incomes, and what that means to them, of having a pharmacist to really tell them what can they do to save money, what can they do to not be um, not be subjected to not getting the medication that they need. That makes me think back to my interview today with Bev and Claudia, and how that they said that there are people that are their meds are being turned off from a benefit perspective, their medications being turned off from a compliancy perspective. Pharmacists need to be everywhere a patient is. So I want to see, we have Buddy Carter down in Georgia. He's first district congressman for the state of Georgia. We need more pharmacists in our political leadership, and we have to have people that really understand what patients have gone through in fill in the blank, in rare diseases, in diabetes management, in addiction recovery, or getting off of specific meds, or dissecting and understanding how meds affect someone. When I think of the world of PGX and pharmacogenomics, people that are listening right now, you pharmacists right now, are needed more than ever, but we have to work together. I always say hashtag TogetherRx, in order to advance what is best for your patients. And if that means changing state laws, federal laws, and you have to I was going to say you have to, unfortunately, but it's not an unfortunate, it's good. I say that because we're all so busy, and you think, when do I have time to become a patient advocate in my state, in state policy that's being developed? Well, guess what? We need you. We need you. I'm going to just give a shout out to today's episode sponsor, GeriMed. If you've ever heard of GeriMed, they are a group purchasing organization that is always dedicated first to our long-term care pharmacies and the success of our long-term care pharmacy. I met with them at the SoftWriters Conference. They will be helping us, and they are sponsoring the Framework LTC 2023 user conference. They are the conference sponsor for our content. They will help us push that content out, get that content out to more people, that we really are focusing on what's happening in long-term care pharmacy. And I talked with the SoftWriters team, many of the team, and it really impressed me with how interconnected they are, and how that organization at SoftWriters has changed over the years, how they employ pharmacists specifically. Dr. Mark Fulton is the host of Framework Focus. And if you have never heard that podcast, that's one of the new podcasts on our network. Framework Focus. If you Google Framework Focus podcast or Framework Focus SoftWriters, that podcast will come up, and it's a whole perspective of the long-term care industry, and then they tie in some discussion around technology, but it's not just about the technology. It's literally about how long-term care, the growth of long-term care pharmacy in the coming years is going to be immense, and we're going to need more consultant pharmacists. And I give a shout out to those consultant pharmacists that are out there right now doing amazing things. Dr. Lauren Castle, I want to give a shout out to you, PharmD. Lauren is an advocate for her patients, and she's also an advocate for our pharmacists who want to become entrepreneurs. And it's pharmacists, you didn't go to school to understand how to run a business or even how to start a business. So reach out to Dr. Lauren Castle. Go to drlaurencastle.com. Her blog is wonderful. I actually read her blog. She goes through and really has a holistic view of the world and of medicine, of how pharmacists are changing things. She is a functional pharmacist and has developed an organization to bring other functional pharmacists together. I just want to give a shout out to her and her work. I've been paying much attention to people in integrative medicine and functional medicine. We actually will have Robert Kress on, who's known as the godfather of functional pharmacy. He and his network will be coming on talking about very specific conditions and disease states in how functional pharmacy can be expanded. And if you want to do it through a consultant basis, that's fine. And I think there are people out there that can help you build that business. But if you just want to incorporate functional medicine and understand functional medicine in hospital system pharmacy, I mean, there's an element to that, and I think giving back information about different occurrences in healthcare, in hospital system care, in we just mentioned, pediatrics or even specialty disease. Take a look at functionalpharmacy.com. Once again, reach out to Rob Kress if you're interested in understanding his guidance, and I would say it's more application to specific conditions. So working with Rob, he's very down to earth. He has a team of people that are dedicated to functional medicine and living more freely away from just pharmaceuticals. That's not saying he's absolutely not anti-pharmaceutical at all. I'm just saying that he believes in a forward thinking of you think outside the pill box, and it says right here on his website, and I'm very proud of what he's grown. So he is joining the Pharmacy Podcast Network, and we're going to be concentrating on more discussions around functional medicine. So once again, Dr. Castle, I will be reaching out to you because I want you to be part of those conversations. Marina Buskov, Dr. Buskov is the Holistic Pharmacist podcast. Marina is dedicated once again to functional medicine, and she has a really interesting podcast because she brings on people that have actually experienced um, the the application of functional medicine in day-to-day life. And she has a deep understanding in gastrointestinal health, digestive troubles, female reproductive health. I've been so impressed with her podcast, the Holistic Pharmacist podcast. Marina is a wonderful person. She's so easy to talk to as well. And just reach out to her. Even if you are curious to how to leverage her knowledge and what she's built as a functional pharmacist and holistic pharmacist herself, from one pharmacist to another. That's once again, I think, how Pharmacy Podcast Network really stands as an interesting publication that brings people together. It's the network. It's not the podcast. It's the network. We just happened to start using podcasts in 2009, and here we are as you're listening to something through audio and learning. But really, it's the network. It's coming together and being able to work together to, oh man, to get us all past the obstacles that we're in, and every single one of us, you're listening right now, are going through something. You either have financial stress, you have issues in your relationships, you're going through something with your children, one of your children just got sick, or or something's going on that's on your mind that's drawing you down. I've learned, and I wouldn't be in the position that I am today that if it wasn't for my network. And I think of our pharmacy students who are in school right now. I want to give a shout out to Mark Garofoli, who is a professor down at WVU School of Pharmacy. We're going to be going to WVU to see the P3 class that he is going to give us access to again. And we're going to get an opportunity to sit with pharmacists, future pharmacists, as we did last year. It's going to become a tradition on October 23rd. Once again, WVU School of Pharmacy. But what I advocate and what I talk about when I go there, one of the number one things, about a third of my time when I talk to pharmacy students, is about building their network and how important your network is and how you get to control that network, how you can take that network, control that network, and build it in order to reach the next level in not only your own career. I mean, your career is important, but I think we all know as people in healthcare that this really isn't about you. It's not really about me. It's really about our patients. And it's about creating things, models of healthcare delivery together. And I want you to know that I will always stand for networking together and bringing people together and being a voice for the voices of our patients. So a voice for our pharmacist who is a voice for our patients, and how important networks are. I just got done talking to two people yesterday on the fly. I'm not going to say their names because I'm going to save it as a surprise, but I just talked to a young pharmacist and the founder of ShiftRx, that their networks were so important, and they kind of rattled off some of the people that they were tied into and how the growth of what they're doing in the pharmacy industry is really going to change the way that pharmacists, it's going to bring more freedom to our pharmacists. And I see a change in actually a pressure that's going to be put on some of the issues that we've seen coming out of some of the chain pharmacies, the national chain pharmacies, that don't really give that flexibility to a pharmacist who's feeling burnout. And how the model of ShiftRx, and if you want to learn more about this before we bring them on, you can go to shiftrx.io. Once again, that's shiftrx.io. But think about this. If you feel trapped in your career, you're working for some massive chain pharmacy and you're feeling trapped, and you had an opportunity to go work at a long-term care pharmacy for maybe a short period of time, maybe forever, or specialty, or expand in another facet of pharmacy, just to break up that monotony of feeling like you're trapped somewhere. That's why I think this organization and ShiftRx is going to make a difference in our industry. I think they're going to be part of a shift in the name of there, a shift in profession. But I want to welcome Leann, and I think I'm coming. Here's real loud. You have to turn your
here. Come this way. Can you hear us, Todd?
I can hear.
Okay, perfect. It's so nice to be here. Thanks for having us.
It's nice.
Here, we'll scoot back.
Yeah.
Down so.
Okay, there we go.
How are you?
Good. Thank you for having us on the show. We're super excited.
You're very well. So I can
center
my in your right. I don't want. All right. No, I can still. If you, I think I'm coming speakers and it's going back into your microphone.
Okay, how about now? Is it better?
Let me hear. Now. All right.
Hold on one second. Let's do this.
Testing. This is how podcast works. You have to figure it. Yeah.
Okay, hold on. Let's try this.
Headphones.
Headphones. Yeah, we can do headphones.
Or just one. Because you hear me probably.
I'm so sorry, everybody, about this audio issue. Give us just a second to figure this out.
Okay.
We'll do this. I did turn it off, and then headphones is probably going to be best. Okay, give us just 1 second.
Okay. All right, so I just want to describe ShiftRx while we're waiting because I have lots of questions for our founders, but also ShiftRx.io. The organization is pushing out the ability to take on a shift, a specific shift described to you. They're in Texas right now building this out. They're getting a ton of coverage from organizations. They're doing a ton of content development through Instagram. I actually found them on TikTok, even though I'm not ready for TikTok. And it's a opportunity to literally change the way that you work as a pharmacist, whether that is in transition, whether that is finding permanent work. But once again, that's shiftrx.io, shiftrx.io. I'm going to bring them back in, and hopefully we can we can get them to the microphone not to echo. Let me see.
You might have to take it out.
All right. Let me.
Which one?
I'm not sure.
What's left?
I'm not sure. Can you hear me?
Yes, we can hear you. Can you hear us?
Yes.
Okay, perfect. And is there an echo?
That's all right. Yeah. I think it's good.
It's not in.
All right.
We are connecting headphones here.
Okay. By the way, TWIRx listeners, Speak Pharmacy listeners will not be the last you hear from them. We're going to have them on multiple times because I think there's an opportunity here once again to grow what this business is going to do for the opportunity of pharmacists who are in transition. You've moved. You are a new parent. You're a new mother. You want to pick up some work for a certain period of time. And I just don't think that there is an organization out there right now that is doing this. So think of what Uber did to the world of taxis and the world of transportation. And geez, we wouldn't think of being subjected to just a bus right now, or being having to find a cab when you can go to your phone and go to the app and go to Lyft or Uber and find a ride. And I see this as the Uber or the Lyft of the pharmacy industry, and how state after state, as they roll out to different states, ShiftRx.io is going to give you so much freedom if, in fact, you are in a position within your career or a position within your life that you need an ability to tap into another way of working. And it might be a short term or it turns into a long-term opportunity. So I just think it's brilliant, and and I'm looking forward to talking with both.
Hey, Todd, can you hear us?
Yes. Yep. Can you hear me?
Yes. And is there still an echo?
Yes, there is.
Oh my goodness. We're so sorry. So yeah, basically we're super excited about it. Sorry about the echo. It's our first podcast here.
If you can't tell.
Yeah. We got the boom mic going, but for us, we should have thought of some headphones first. I guess I hadn't thought of how that works.
Just tell us about Shift.
Okay, so ShiftRx is a platform very similar to, Uber or Instacart, but what we're trying to do is provide ultimate flexibility, pay transparency, and higher pay to our pharmacy providers. So the way that it works is, like, right now you have a traditional staffing agency. It can take up to 6 weeks to place and vet candidates. They take up to 60 to 120% commission. So the provider really isn't getting a lot of that on the back end. And what we do is we cut out recruiters. So nobody's a better recruiter than yourself. You can log onto the platform. You can see the shifts that are available for both on-site and remote. You can request to book it. There's no obligations, no contractual, reoccurring obligation, and there's no hidden fees. We give a lot of the percentage back to the provider. So we only take a percentage from the facility. So our providers on average are making anywhere from $10 to $15 more an hour with us than they'll make anywhere else. And then they get instant cash out when they're done.
That's awesome. All right. I need to hear back from both of you. Take time to introduce yourself. Tell us a little bit about you.
Sure. So yeah, I started my career in pharmacy. So I worked as a pharmacy technician and manager at CVS for a good 6 years. So retail is pretty brutal. And then I worked on the clinical side as an MTM manager, which I also really liked, but it's the same problems all around in the pharmacy industry. We're all burnt out, we're stressed out, we're underpaid, and it's hard to keep good talent. So yeah, Autumn and I created ShiftRx to kind of help with these issues and kind of further incentivize people to actually want to work because they're getting $5 to $10 more an hour with us. And, we've gotten amazing testimonials since we've started this in Texas. People are going crazy. People want to build out their entire full-time schedule with us, and we're super happy about that. And we are actually expanding to California at the end of the month. So
Excellent. Well, I'm going to have both of you back, I promise. We'll figure out the audio thing. I know that I just talked about this to you yesterday, and then we threw you on today because I wanted to get as much press out about you as possible in order to support you with some of your upcoming initiatives. So thank you for being here. And we're going to schedule you back as soon as possible in the near future, probably within like the next 3 to 4 weeks.
That would be great. And we'll have 2 sets of headphones ready to go.
Great. Thank you. All right. I'm so sorry about that. But that is the world of live. We should be doing some testing. I actually just got back from a conference. When I'm flying around and doing everything that I'm doing, sometimes it's hard to make sure that you're ready to go for an event that you decided to do 12 hours ago. I want to welcome who I thought was going to be our first guest, but we're going to shift him to the second place. Dr. Cory Jenks, welcome to This Week in Pharmacy.
Thanks. Good to be back with you live. This is cool.
This is live. It just no pressure on you that you have to execute and not make any mistakes. So there's no mistakes right now.
I'm not at my day job, so I live in a world full of whatever goes. So I'm an improviser. You know that. I roll with the punches. That's sort of my brand.
You as well. I got punched in the face all this week and on multiple different things that I just kept rolling with the punches. But the attitude that you have, the content that you develop, I just think it's a breath of fresh air. It's why I wanted to have you on. I want to get people to know you. I want more pharmacists to know about you. So that's really why you're here today. I want you to tell people why you wanted to become a pharmacist, and then definitely we need to dig deeper into permission to care.
Yeah, well, I wanted to become a pharmacist to help people. I think that's where a lot of us got into it. That and that sweet paycheck, right? Hey, it's all right. It's okay to make a good living helping people. I chose this literally 20 years ago when I was a junior in high school. And so I graduated pharmacy school 2011. I work in ambulatory care. I do disease state management. I'm also an improv comedian. I'm also an author, a speaker. You can see my book. Oops, I'm backwards here. Permission to Care behind me, right over my shoulder. So I write about the application of my comedy brain into creating a better healthcare culture, how to roll with the punches, how to create more humanizing experiences with our staff, with our patients, giving those tactical skills to the pharmacist one-on-one, because, it's a weird combination. Like, it's confusing when I say I do comedy and I'm a pharmacist, but it really transformed a lot of frustration my first couple of years once I started using these skills I learned on a comedy stage. So we can use these tactical skills as pharmacists. And then for those of you in leadership, my goodness, building a culture that thrives in the chaos, like today, just now, echoey headphones, links that didn't get through the internet, so I didn't get here on time. How do we deal with that? We can smile through it, or we can fret and panic our way through it. But like us, we're having fun through it. So I can say that like 10, 11 years ago, I would not have been as nearly able to roll with the punches as we have today.
That's hilarious. But you know what? It's not like we have a course. I know you didn't have a course. I know I didn't have a course in pharmacy school that says this is called Disaster 101 and how to, knowing that in your life at a emergency room, or knowing that in a long-term care facility, or somewhere on your at a grocery store pharmacy that you work at, there's going to be some disasters, and there's going to be things that are going to happen that are out of your control, that you didn't, it wasn't your fault, or maybe it was your fault, it was a mistake. But how do we recover from that in order to not only stay professional, staying respectful, but continuing, just as you said, the very first words that came out of your mouth when you said why you wanted to become a pharmacist is to help people?
Yeah. How can you maintain that composure and still maintain those relationships, maintain that trust with patients? I mean, just 2 days ago, I had someone come into my office for a diabetes consult, and or something else, and they wanted me to pull a thorn out of their finger. And I said, I don't think you want me doing this, because I'm not trained to do that. Let's focus on the task at hand. So this is what I'm talking about. And by the end, the patient, they didn't get what they wanted because they didn't pull the thorn out of their thumb. But what they got, by the end they said, "Oh, well, you're my favorite pharmacist." And I was like, "What? I didn't give you anything you wanted today. I didn't touch the rash on your foot. I didn't take the thorn out of your thumb. Like, my kids don't want me taking the thorn out of their thumbs. My wife's a nurse. Like, let them do it, right?" So, but despite that, I was able to get through this, this appointment, and still maintain that trust, that rapport, to where they left. I said, if you wanted a different pharmacist, there's other ones that work here. And they said, "No, you're my favorite," which blew my mind. But hey, we were able to make it work. So rolling with all the weird stuff we see. It's not always a disaster. It's just like weird stuff that you just are not taught in pharmacy school, residency. It's not on your board certification test, not on your board exams, none of that stuff. So how to be a human being, basically, how to talk like a human being to someone else.
Well, let's talk about this.
Yeah.
Special book. So Permission to Care. Tell me why you wrote a book. I love that you personalized mine when I got it back in December. I like this book because it makes me feel, I don't know, it makes me feel like all of my passion that I always try to sometimes hide. I think that passion and professionalism sometimes can get blended, and people feel that they're not allowed to give off the passion of care per se, and we have to stay real super clinical and real super professional. But share with our listeners the meaning of this book and why you wrote this book.
Yeah, I wrote it. I think you really hit the nail on the head there. I think like pharmacy school, you're beaten over the head with this idea of professionalism. And it's important to be good at your job. It's important to be competent. It's important to be respectful of your patients. But my goodness, it like beats the personality out of all of us. And I found that even in situations where I don't know the answer for a patient, and clinically, if I was the best clinical pharmacist, I would know that answer right off the top of my head. But I can talk and connect to people. And I think it was born of a few things. It was years of lessons I've learned. The book goes through several stories I had with patients, of applications of lessons I've learned that kind of reframe my brain from just putting that passion and personality out towards the public. And the frustration of both the patient side of things too, because I also talk about personal experiences being the consumer of the healthcare system. When you're treated like a number, you're treated like a diagnosis, you're treated like a prescription number, and it just disengages you from your care. So I don't care if you have the best clinical knowledge in the world. I wrote this book so that you could talk to people and make them care about it. Or I wrote this book so that if you are a manager, a CEO, and you want to create a hospital where your patients actually listen to what your doctors and pharmacists say, and actually listen to what you ask them to do, that they do it because they're bought into what you're doing. A lot of comedy, what I do, is from a place of honesty and truth. You think of the show like The Office, for example.
Yeah.
We've all worked with a Michael Scott or a Dwight, like the people who take things way too seriously or somehow have failed to the top of the food chain. Like it happens all the time. It's because it's true. And so like, if we got to take these true experiences, our true selves, and make our patients care about what we're saying.
So tell me about comedy. I want to shift that gear. Like, how does a pharmacist get into comedy, and when did you that, you know what, that would scare me more than anything. I mean, we're live and it gets a little bit, nervy per se of your, maybe I'm normal like everybody, but if you said, I need you to go up on stage and I need you to make 100 strangers laugh, like I'd be like, nope, check me out. So talk to me about comedy.
I mean, I started liking comedy when I was like 5 years old. I joke, my parents, I had a TV in my room from the age of like 5 or 6. And so I was watching The Simpsons like every week. And then it was on syndication. And then, as they got older, it was Saturday Night Live. And then I would sneak South Park in, when I was 12 years old. My parents didn't know I was watching it. So I've always loved comedy. I would go to school the next day, back when you had to watch everything at the same time. We didn't have Netflix or DVRs. And it was this shared comedic experience with my friends of just quoting Homer Simpson, Bart Simpson, the SNL sketch. And I loved it. And I got to pharmacy school. There was an improv comedy group there. I went, my mind was blown, but I was a dutiful professional pharmacist, so I didn't do any of that. I ignored that improv itch. And then when I was done with my residency, my wife was in grad school she's a nurse practitioner. I had all this time because I'd finished my boards, my residency. I was just working my 40-hour-a-week job. And there was an improv class available, and I took it and just sort of like dove headfirst in and bought into the culture. And it turned into performing, teaching, coaching. And then it just hit a place where I'm not funny enough to be on SNL. I can make 100 people laugh, I think, but not, I don't want to move to the big city. And, I'm happy here in Tucson with our now 3 kids. Like we're good here. How can I take this comedy and take it to the next level if I'm not going to be doing that performance piece? Well, it's the application piece of using it to make healthcare better.
Does that work? Like, are you able to reach out to some local organization in order to continue to get yourself in? Because to me, the way that I get best at something is constantly doing it. So are you scheduled ahead of time of where you're going to show up and like what theaters or what, public?
Yeah. So I have a local theater in Tucson here that I still perform at periodically. It's just, I mentioned 3 kids under 5, like the ability to go out, rehearse and perform is just not, I don't have a ton of bandwidth for that. So it's like maybe once a month I do that. But I get a lot of my work in is going to hospitals, pharmacy organizations, and doing what I do. I don't just go and perform. I'll do keynotes, I'll do workshops, integrating these skills and getting the pharmacists, and all you pharmacists who think you aren't funny, you are, because you're smart. And that's all you need to be. A good improviser is smart and listening. So improv teaches these listening skills. So I'll go to these events. And I think that's where I really enjoy my other pharmacy practice is putting these skills into play, going to state associations. I was at Midyear last year, did a big talk there, and getting people to play. And you talk about professionalism and personality, like not mixing. You're allowed to have fun at events when you're getting CME. I make sure of that. Like who here, if you're listening, you're a pharmacist, who's been bored at a CE event? Hand raised. Like I've been there. They're boring. They're dry. I make it fun. And you leave there with some aha moments, some light bulbs going off, and some new abilities that were within you the whole time that I just had to kind of draw out of you, make you a little uncomfortable. It's not in front of 100 people you got to make laugh, but I get people up in front of others. Pharmacists don't like that, which is exactly why you need to do it in a sort of safe, controlled environment to learn how you can better connect with your patients and provide the care you want to.
So what about ImprovRx, which is on your site? By the way, if you're listening and you're not watching us, CoryJenks.com. That's Cory, Cory Jenks, JENKS.com. Tell me about ImprovRx.
Yeah, so ImprovRx is just the name of the company I built. And it's just, I'm a pharmacist with a side hustle. So I just put RX at the end of anything I was doing. So that's how I came up with it. Very brilliant, right? I do improv. I'm a pharmacist. But I like, as you see on the screen there, I like to call it evidence-based comedy because there is literature supporting the use of improv in the world of healthcare. And so I mentioned CME events. So I can go in front of an audience, make people laugh, have fun. But if I'm at a state association meeting or a big event, people want to get value for their time and money. So everything I do can be accredited through ACPE or any number of different, nurse practitioners, nurses, doctors. So I take the evidence, I present it, and then I have the participants apply it, and we have a good time. And I leave, a lot of the feedback I get is, I've never had that much fun doing a CE before. Yeah, because they can be fun. You should be having fun doing CEs, because if you're learning something that's going to actually help patients and make their lives better and make your lives better, it's fun. So that's what I offer to whoever wants to bring me out around these great states or world. I have not gone international yet, but that just means there's a lot of opportunity.
Anyone
listening from around the world, I will travel. I have a valid passport.
I want to make a non-clinical assertion, an assumption, and that is that if I'm listening to content from someone and I'm trying to get CE and it's boring as hell and it's, you know, it's hard to sit through, but you have to sit through at least an hour to get 0.05, I think, right? Or is it?
I think it's like a 1-to-1, so 30 minutes for 0.5.
Okay, so 30 minutes, 0.5, or hour to get 1. If I'm laughing and enjoying it, I'll bet you people that go through CE that it actually was fun will absorb it faster than people that went through it that were bored out of their minds.
Yeah, I'll answer that with a question. You know, what's your favorite sitcom?
Used to be, actually, my favorite sitcom ever was Cheers.
Cheers. I bet you could quote Cheers, or like your favorite movie. Like you can quote these. You know, I can quote The Office. I can quote Seinfeld. I can quote The Simpsons. I can quote it and remember these things like 30 years after seeing something, 20 years after seeing something, because it's funny and it sticks. And this is something, I mean, I learned from my 8th grade science teacher. When you do something that's funny, it's going to stick in your brain, because his parents would yell at him because he could remember, you know, he'd listen to a comedy album, he could repeat it verbatim. But when they ask him to do the Krebs cycle or some scientific, you know, some stuff with science, you're like, I don't remember that, because it's actually fun and applicable, and you're engaged. And you know, one of the big buzzwords right now in pharmacy and healthcare is burnout, resiliency. And the truth is, like, when we are playing, you know, improv is adult play, I call it that. You are rewiring your brain. You're rewiring your neurons to be more resilient. You will, you know, you could go to a meeting on resiliency and listen to a 60-minute boring PowerPoint about 17 self-care habits, or you could go play with me for an hour and you'll actually leave there with a little bit more resiliency in your brain, a little bit more levity in your soul, and some tools to go out and deal with all the crap we have to deal with. Because I can't change that. You say, we're in a world of unpredictable things. There's a world of chaos. You know, the subtitle of Permission to Care, building a healthcare culture that thrives in chaos. We can't control that, but how can we build those muscles in your brain to reply and to live it with those much more effectively?
Permission to Care, building a healthcare culture that thrives in chaos, by Dr. Cory Jenks, PharmD. I'm very proud of you, Cory, in representing pharmacists as, you know, as a publisher and someone who cares enough to do this book on top of your job, on top of your family, on top of, you know, your marriage. And I mean, I know what that's like. I've wanted to start a book, and I've stopped and started the same book a couple times over 3 years. And it's encouraging me to see this published, but more so what it means, and how when I read it, I can tell you do care. It is extremely sincere, as you come across when I watch your videos, as being very sincere too. And isn't there something to that today? I mean, it's unfortunate, but transparency and being honest and sincere is so important today.
Yeah, well, I think great comedy comes from a place of truth. I will, you know, one of the laments I have scrolling through any one of the social media feeds, from Instagram to LinkedIn, it feels very manufactured. I can tell you that what you're getting with me is pretty much straight shooting. I'm pretty blunt, pretty honest. I don't want to be rude, but I'm, you know, I've been in pharmacy over 10 years. I kind of hit that point of, I'm not a 40-year guy, 30-year guy, 20, but like I've seen enough to be like, okay, I've seen these patterns before. I'm not dealing with this. You know, you got to be authentic. And that's if someone's going to take the time to read my book or read a post, I don't want it to be a bunch of BS. I want it to be authentic and come from a place of truth. And so I appreciate the kind words about the book. Spoiler alert, I have another one coming out probably early next year, non-pharmacy related. It's a book on being a dad. It's a humorous guide to being a dad. So very big departure from Permission to Care, but it was one of those books that I just had in me that I couldn't keep in my head. I had to get it out on paper. And so super psyched to add it to my I would say Pantheon, but it's just my second book, my second offering. So stay tuned for that. If you want to keep in touch with me, go to my website, sign up for my newsletter, and you'll know all the deets as soon as they're available. So
have you planned your next trip? Like, where are you going next that you'll be performing?
That I'm performing. So I'm going to Tennessee in November to work with a group of nurses. Okay. So really excited for that. I'll be in Boston next year with a group of pharmacists. a couple other hopeful ones next year. But if you are listening and you have any sway within your hospital or your organization, and you're like, we need something fun for our event, I will provide the CE and the fun. It's a double whammy with me. And I'm a pharmacist, so I can relate. I'll be authentic and real with you. So I don't just go in and blow smoke and say, everything is great. No, improv is acknowledging reality. It's not all great, but how can we make it better with where we stand today? Like that's where I'm at here, planning the next few months. So.
Well, I want you to promise that you're going to come back and we can go through. I'd like to have you as a guest host on TWIRx and just go through kind of like a state of the nation and kind of talking to pharmacists directly. I'd also like to have you come back with other comedian pharmacists, like a shout out to Dr. Marie Shaw, Doctor of Comedy, and have like a fusion of comedy pharmacists as well.
That'd be great. That'd be a good time.
All right. We appreciate you. Thank you so much.
You as well. Until next time.
Yes, until next time. All right, here we go. The end of TWIRx. This was a shit show. I said shit on, but guess what? That's going to happen in life. I love pharmacists. I love pharmacy technicians. I can't get enough of hearing from you. I just received 16 emails this week while I was out on the road at different conferences from pharmacists that want to collaborate and do something through the Pharmacy Podcast Network and through our hosts, which, like I say, we have like 52 hosts that are concentrating on content build out. And if you want to be a part of that, if you want to participate, please reach out to Pharmacy Podcast Network and I'll make it happen. And if I can just help you with something in your pharmacy career as a pharmacist or as a pharmacy technician, reach out to me. Have a great weekend, and we'll see you next Friday.